Hello, I'm Dr. Paul Charleston. I'm going to speak to you today about botulinum toxin myths. That's Botox myths. I've been treating patients for over 20 years and probably done about 20,000 botulinum toxin procedures. There are a couple of questions that come up frequently is, how long does Botox last? Well, that's a variable feast because it depends on the dose and the patient and the site. The thing is that if you increase the dose of botulinum toxin, you get an increased effect up to a ceiling dose. Beyond that, you don't get any further effect. So you're trying to get a ceiling dose when you treat a patient. That's the first thing. So secondly, the type of toxin matters. Some toxins last longer than others, and some are now manufactured to last longer, and that can make a significant difference. The third thing is really about perception, because people who have botulinum toxin regularly probably hasn't quite worn off before they get the next one, so they get a bit of a cumulative effect. And probably the other thing is perception, because if you are looking for a completely fixed look, then botulinum toxin Botox is not going to last that long. Probably 70% of people get some movement after 8 weeks, and certainly a significant percentage get significant movement after 12 weeks. And you might say that's worn off. Some people are quite happy with a slightly relaxed look and maybe wait 5 or 6 months between treatments. Others are straight back to you within 3 months as soon as they've got a lot of movement. So it does vary. The other thing is lifestyle. Probably patients who exercise very regularly and quite vigorously, botulinum toxin doesn't last as long. Taking oral zinc may improve its longevity, and there's still some research to be done on that area, but that's of interest. The second thing is the myth, the whole myth about botulinum toxin, what you can't do. So it always says you can't exercise for 48 hours, you can't fly, you've got to sleep upright. It all becomes very difficult. But in fact, once you've injected the toxin in, within about 3 or 4 hours, it's absorbed into the cells, and then it can't really go anywhere else, and it's just doing its job. So there's very little you can't do after a treatment, certainly not rub it for a few hours because that will spread the liquid. But other than that, you can just get on with your life. So those are perhaps a couple of important questions that people ask, and I hope that's helpful to you. Thank you very much.